All right, this week is National Public Health Week, and yesterday the World Health Organization launched a new year-long campaign to promote maternal and newborn health.
Mama, I love you. You hold me, you keep me safe, you are my world. Not every baby gets this chance.
Every 7 seconds, a mother or baby is lost to causes we could prevent. Not enough midwives, not enough medicine, not enough time. But this can change when we invest in science, in strong health systems, in equality, when we make the choice to support mothers and babies, when birthdays are moments of hope, not loss. We protect the future. Because every healthy beginning means a hopeful future for us all.
Joining us now, Director of the Department of Epidemic and Pandemic Threat Management at the World Health Organization, Dr. Maria Vankerkove. Doctor, thank you so much for being on the show this morning. So tell us specifically about this campaign, and are there areas where preventable newborn deaths are going up?
For sure. So thank you very much for having me on the show. It's really a pleasure to be here. And as an American, I'm really happy to be on in a morning show talking to all of you. So yeah, it's healthy beginnings, hopeful futures. And thanks for playing that video. The importance of maternal health, of newborn health. There are so many ways in which we can advance and save the lives of newborns and mothers through prevention efforts, whether we're talking about prenatal care, whether we're talking about regular health checkups, whether we're talking about vaccination. And I know that covers the segment that you just were discussing related to measles, but many different ways we can cover and support women through their life course, and of course through the development and of pregnancy and having babies.
Go ahead, Dr. Gupta.
Maria, thanks so much for being here. You and I have had this conversation, but I wanted to say it for this conversation. Can you make it clear to our audience, to the American people, why the WHO improves their lives? What does it do? Because I feel like that message has been confused. I think a lot of folks don't know what the WHO actually does every single day to improve their life.
Yeah, thanks, Vin, Dr. Gupta. It's really great, again, to chat with you and to talk with you. We do several different things. And, as an American, I was born in New York, upstate New York. And as a kid, I didn't need to know what WHO really was because we had health care. We went to the pediatrician regularly. But we live in an interconnected world. And the diseases that we fight do not respect borders. One of the things that we do is we bring 194 member states, countries, together to tackle some of the world's biggest problems. The area in which I work is preventing pandemics, preventing outbreaks from turning into epidemics, turning into pandemics. And one of those ways is through strong surveillance activities in all countries. So the earlier we detect something, whether we're talking about Marburg in Tanzania or Ebola in Sudan or Mpox or Oropoucha, whatever, pick the disease, the sooner we can detect it, the sooner we can protect populations across the planet. This keeps Americans safe at home and abroad. It keeps all of our member states, it keeps everyone everywhere safe, because the earlier we can react, the earlier we can prevent. The second thing that we do is we turn science and data into action. And that we develop evidence-based guidance, bringing together the world's best minds, including American scientists from government agencies, academic agencies, and again, across all of our different member states, different disciplines, different experiences, different expertise, to turn data into knowledge, into know-how, and to help governments, to help physicians, to help parents make the best decisions to keep their families safe. And the third thing that we do, one of many, is to advance R&D, research and development. We work with public health institutions, manufacturers around the world to develop safe and effective medical countermeasures, like diagnostics, therapeutics, and vaccines, like you were just talking about with measles, to test these vaccines to make sure not only are they safe, but they're effective, and that parents, again, have a proper information, governments have proper information to make decisions to keep their loved ones safe.
Maria, in our last 30 seconds here, WHO has faced a lot of criticism, as you know, over the last, since the pandemic has really set in. Wondering what you can say, how is WHO addressing issues of reform? How are they addressing the criticism?
Well, thanks for bringing this up, because we are addressing reform constantly. We are a learning organization. We are a technical-based organization. The reforms that we started actually began when DG Dr. Tedros took office in 2017, and we've been adapting ever since. We've learned so much through COVID, and COVID's not gone, by the way. There are many current threats that we face that we have to be ready for. We've been looking at sustainable financing. We've been looking at how we are operating in terms of how we support our own member states. We are looking at how we bring more people together so that we can act faster to prevent these outbreaks from happening in the first place and then from progressing into pandemics.
Director of the Department of Epidemic and Pandemic Threat Management at the World Health Organization, Dr. Maria Vankerkove. Thank you for being here, and thank you for your work. We appreciate it. Dr. Gupta, before we let you go, I just want to circle back to this measles story here in the United States, because it is concerning parents. You have the head of the Health and Human Services, Robert F. Kennedy Jr., suggesting that a healthy diet is the way to prevent or at least lessen the impact of measles. Maybe it's vitamin A, maybe it's cod liver oil that will help you. What is it? I mean, those have been sort of tossed to the side by serious people who study this stuff. But what is the impact of having someone with those beliefs at the very top of our health system? How does it trickle down into the system?
Well, what we're seeing is that he spent 20 years, Willie, putting that motif into the public discourse, and he can't just reverse course now. And that's what we've seen. The damage is done, and people and now really are firm believers that things like a healthy diet, which is really good for cardiovascular health and overall health, but it's not good. It's not sufficient to prevent an infectious disease. These motifs are hard to break down. Once they're in, people will believe them, and he's been the leading purveyor of that. So he's created a set of problems for which he has not built a set of solutions for. But this is not something that can just be reversed overnight.
Yeah, he's real power now. You can't dismiss it anymore. NBC News medical contributor Dr. Vin Gupta, always great to have you at the table. Thanks for being here.
Thank you.
Joe?
And as